Hello, my name is Leticia Jimenez, and I'll be giving my informative speech today about what is a medical assistant and what do they do. For my audience, I'll be having my brother, Carlos.
Hello.
All right, so what is a medical assistant and what do they do? Have you ever been in a clinic or a hospital and run into somebody or heard of somebody called a medical assistant? Or maybe you made a phone call to schedule an appointment with your physician. Most probably the person answering your call is a medical assistant. These people make such a huge impact on patients more than one may think. Medical assistants are an important member of the healthcare team. Not only do they help their physician with clinical duties and administrative duties, but they also help communication with patient. So hopefully by the end of this speech, I can help educate my audience more on what the importance of being a medical assistant is. I am currently attending Kaiser University to become a medical assistant because I always wanted to be in the medical field to help people who are in need. Part of being in school, I had to do 2 months of externship, which I was doing at Tampa General Hospital. Even though I was only there for 2 months, I learned a lot of new skills, and I was also able to speak to real patients and take care of them. One of the many responsibilities of a medical assistant is clinical duties. Clinical duties such as making sure the medical history and the medication is up to date. For example, when I was doing my externship, I would call in a patient and guide them to a physician's room, and start off by asking them why they were there, their chief complaint. After that, I will go over the medication to make sure it was up to date and remove any medication that they're not using anymore. I will next move to a pharmacy just in case they need medication prescribed that day, just so that it goes to the right pharmacy. Then I will move on to the medical history, such as if they had any surgeries since their last visit, or if they had any ER visits since their last visit. We also have the responsibility of taking patients' vitals, such as their blood pressure, their temperature, and their heart rate. We assist the physician in medical procedures such as a pap smear, a pelvic exam, or EKG. We also have to assist the physician by preparing the patient before this medical procedure. For example, for a pap smear, we need these little equipment, so we have to lay them out for the physician before they enter the room. We also are responsible for collecting specimens such as urine, stool, or blood, and send them out for labs if needed to. We're also responsible for performing a basic medical test such as COVID or flu test. Another responsibility that we have is administrative duties, which are more front desk duties, such as answering phone calls from patients that have any questions or any concerns. We also have the responsibility of scheduling patients' appointments. We also have to call a patient a day earlier if they're scheduled for an appointment, just so that patient has a reminder and doesn't forget to come into their appointment. We also have the responsibility to maintain our patients' records and make sure they're up to date. And we also greet and direct patients in the waiting room. The last but most important responsibility that we have is communication. Not only communication with our physician, but communication with our patients. We have to be able to communicate test results and instructions, but also we have to provide emotional support. Some of our patients come in suffering from an illness or suffering from depression or anxiety, and we as medical assistants have to be compassionate about that. I had a lot of patients of mine when I was working at Tampa General Hospital that just came in just to talk to somebody, and I feel like we as medical assistants have to listen to these patients because we do not know what's going on in their lives. So next time you're in a clinic or a hospital and you see a medical assistant, just let them know that you appreciate the work that they're doing, because believe it or not, it will make their day so much better. And my references are What is a Medical Assistant, published by Maddie Carl, and the important role of a medical assistant by Allen School of Health Sciences. Thank you.